Hi. Hi there. Hey guys, it's Maggie and I'm back today for another video. I thought today we would talk about wound care and what I'm doing to dress my incision, because a lot of you are giving great suggestions, but I do have a regimen that I've been recommended by my surgeon, and I actually started before he even recommended it, so that works out well. But here's Zach. Show your mug first, because it's very
relevant.
Yeah. It's a chicken mug, and we are outside with our chickens. So we've got the guys outside to do a little bit of free ranging.
Oh, they were stealing my lunch.
They were stealing your lunch. They really like pizza crust, apparently. I see you. I see you back there. You might get pecked in the butt, just FYI. Hi.
Don't bite my finger.
Hey. I'm sorry.
Nope, that's...
Ooh. Oh, he just pecked you in the scab. Hi. Don't peck my phone. No. No. No, you be good. You be good. Yeah. Should we get him back in the coop?
I think so.
Cool.
Alright, dudes.
Let's go. Oh, keep your thoughts to yourself. There's the barn. Yay. Alright, we're gonna go inside. Alright guys, so I am up in the office and we are going to get some use out of that guy because I want to talk about how I'm caring for this anal closure, proctocolectomy, Barbie butt surgery. I know that Barbie butt offends some of you, and if it does, I don't care. I have to use humor in this interesting life of mine, so we're going to use that term. If I feel like it, I'm going to say it. But I'm sitting here in front of the real camera so that way I can show you the products that I'm using, and, you guys will actually be able to see what they are. So let's switch over to the nice camera. All right, I can turn this guy off now. So we are going to talk about how I am caring for this wound. I am doing pretty thorough wound care, and I did get this reinforced by my surgeon that I was doing the correct thing, and it's actually what a lot of you recommended, so thank you to those who recommended doing it this way. I've been getting a lot of recommendations about how to care for this thing because I'm talking about it online, and I'm getting recommendations like, why don't you get a wound vac? Why don't you get hyperbaric oxygen chamber therapy? And to be honest, those are really great for really difficult wounds. This is not considered that yet. Yes, it takes a long time to heal this kind of wound, but that's par for the course. This is how it goes with these kind of wounds. Not for everybody. Some people heal up fabulously, very quickly, and awesome to you. I'm not one of them, and a lot of people aren't, unfortunately. But that kind of therapy is meant for, big wounds, complicated wounds, wounds that just are refusing to heal for whatever reason, and there are so many factors that contribute to delayed wound healing. There might be something else going on, you might not have the right nutritional status, you might be on medications that are preventing it from healing. There's just so many things. When I left the hospital, the only thing I was told to do was use gauze and place it, in the crack and handle it that way. And what I thought I would do actually is show you, I'm going to draw you a picture of the wound. I'm not yet comfortable sharing it, but once it gets a little bit more healed, I definitely will. But I'm going to draw on my phone so you guys can see it, and I think I'll just scoot over so you guys can see it right here. So my incision went from my tailbone pretty much to next to my vagina. And it went all the way up to my tailbone because it was found that I had a fistula. It actually was a fistula and healed before the surgery ever even happened, and I didn't know I had it. I knew that something weird was going on. I had a weird, what I would call a skin tag. I mean, that's what I thought it was. in between the cheeks, right near my tailbone. Turns out it was a fistula going straight through, but at some point it healed. My guess is probably when I went on Humira, because I've had that thing for a few years now. And then I went on Humira in November of 2019, I think it was. So it probably healed because of that. But let me show you, I'm going to draw you my wound. We're going to start, here is my tailbone. And down here is the vagina. And then the wound was basically tailbone to vagina, and it started off great. There was barely any drainage. I mean, the whole thing was sealed up. They did do real stitches in me. If you've seen, you go back a few videos, there's me getting my stitches removed, and it was the worst pain I've ever felt. It was pretty terrible. But the first opening that happened was a couple months after surgery. It was in February, and I had surgery in December. And it was right near my tailbone. No big deal. It was pretty shallow, so I wasn't worried. And it looked like that. So, fine, whatever. I actually got it to heal up a few times, and then it just keeps reopening because that area, it has a lot of tension, and I can feel it. I have ripped it open. I can feel it ripping open because there's just tension there. So I don't know what's going to happen with that wound. It might just take a lot of, careful sitting, careful moving to get that thing to heal, and I have a feeling I'm going to have it for a long time. The next one that came, actually the next two, because they're very closely related, as you'll see in a moment, started right near Lady V, and it was two pretty deep holes. I could not see the bottom of them. And then there was this area that I'll put a little arrow. That looks like a little skin bridge. And what we are figuring is that those two holes actually are connected underneath of the skin. So the skin healed over it. That was totally fine. But then these two holes are opening. And I did have a CT scan that found that there was a fluid collection pretty much right above where these two holes are. Not a large one, but a fluid collection. And so these two holes have been draining a ton. And that's where we're going to get to the point of what you guys recommended me try, because all I was doing was putting gauze along this whole thing, just, gently tucked in there, and it wasn't doing a whole lot. My skin was breaking down. I had what looked like fungal infections because the skin was always wet, and it was just really a pain in the butt. Some of you guys recommended a couple products that I should try about a month ago, maybe a little bit more than that, and I will say that it shrunk the two bottom holes in half. They were a lot larger than they were, and because of you guys recommending that, I would say that it definitely helped these wounds heal. And even when I went to my surgeon, he said, yep, keep doing exactly what you're doing. But I think before I actually show you these products, some important things to also keep in mind is you want to have a really clean wound surface. There is a lot of gunk that builds up as the dead tissue kind of sloughs away. And one of the things that really helped was having a detachable shower head. So I literally put it between my cheeks, nice and gentle, and I have a very lukewarm water. I will rinse that wound out, get it nice and clean, and if I don't do that, I can tell, I can see that slough, sitting on the wound bed. But when I use the shower head to just clean it, does the trick. You can also use peri bottles for, postpartum. It gives enough pressure from the water coming out. That'll help clean the wound, but it's not too strong that you're going to do more damage to the wound, so that's an option. The other thing is, how the heck are you supposed to see this wound when it's up your butt? Now, Zach did a lot of my dressing changes, and that is one way to really bond with your fiance if you are looking for something good. But he did my dressing changes for probably the first 4 or 5 days, and it got to be a pain in the butt, literally, because every time that I would use the bathroom, I would somehow pee on the gauze, and I was like, okay, I can't call him in here to change my dressing every time I go to the bathroom. That's just irritating. So I have to figure out how to do this on my own, especially when he has to leave the house and go out in the world. I have to be able to do this on my own. And the way that I figured this out, and you're gonna laugh, the magnified tilting vanity mirrors. Amazing. So what I do, this is like a very particular thing that I do, and you know, you got to find your own setup. You're going to have to play around and even play around before surgery. We have a light that is right on the ceiling, and then we have vanity lights. So I've got some good lighting options in our bathroom. So I turn on both of those, and then I set up the vanity mirror on our toilet seat. And I angle it so I can see into my wound, and the light reflects off of the mirror into the wound. It's perfect. I mean, I can see the wound amazingly, and I use the magnified side so I get a closer look at it as well, and that really helps me when I dress it. So that is my recommendation for wound care if you are going into this surgery. If you can get one of those cheap vanity mirrors, Walmart, Target, wherever, that was the best thing that I just happen to have. It's been so helpful. I use it every day now. Probably laughing at me because it looks kind of funny, but whatever, it works. So now to the products that you guys suggested I use. And the first thing, and this is something that I do during the day. So I have a daytime routine and then I have a nighttime routine. I use alginate dressings, and this is a dressing that is really good for not exudatus, because that's not a word, for wounds that have a lot of exudate or drainage. They're very absorbent. They're more absorbent than gauze. You can get them in all different shapes, so you can get them in squares or you can get them in rope. I get them in rope, and it looks just like this. So it's like kind of foamy looking, but it's not foam. Very fibrous, and it kind of turns into this jelly, gelatinous substance when it gets wet. So I will actually cut this in half. This is a piece I'm not using for those of you who think I'm going to stick this up my tushy after touching it. I cut this in half, and then I will use sterile Q-tips to place it into the wound. These have been really helpful because I can push this deep as I can, as gently as I can, into the wound to pull the fluid out, and it really does this. I would say since I had the silver nitrate with my surgeon and I had all that drainage, I'm down to like 3 or 4 times a day doing dressing changes, whereas before it was like 6 or 7 times a day that I was doing these dressing changes. So that was a trip. But if you're looking into this is something I got on Amazon. It is an expensive dressing. It's not the most expensive you can get, but this is the box. This cost me, I think, $8 per box online. Now, just to ensure, because if I can't get to the restroom in time, it does get saturated and then will leak. So I will use a bit of gauze. I'll cut off a strip of gauze and just place it into the kind of the crack, and that helps hold the alginate in place. It actually sticks pretty well in there, but it holds it in place, and it also is like a second layer, an absorbent layer. I don't like fold it over or anything. I just use one strip because I do want air to get into that wound. This is really great because wound care is like interesting. You want to have a nice moist wound bed, but you don't want it too wet, and mine is too wet right now. You don't want it too dry also. So there are wound dressings that add hydration to wounds, but I don't need that. I need the exact opposite. So this stuff helps pull off the dead tissue, pulls off the fluid, and makes a better wound surface. And you might be wondering why I was silver nitrated. So silver nitrate is used for tissue that maybe has healed over that you don't want healed quite yet. And the way that wounds work is we have a perfect circle wound, and you've got the edges of the wound. Sometimes those edges are just so excited to heal, they kind of like curl over and heal on themselves, leaving that whole wound bed open, and there's no way for it to heal then, because epithelial cells, the ones that are going to make that new scar tissue, have to cross from the edges of the wound there, and since they're healed over, they're not being made and they're not crossing the wound bed to fill it up. So when you silver alginate a wound, you're kind of burning that healed tissue to reinitiate the healing process. So that is why that was done. All right, and then the other thing that you guys recommended is Meta Honey. So this is the same alginate dressing as this. impregnated with Meta Honey, and I'm going to be very careful. I want to open this and show you what it looks like. Oh, nope. Can you see that? There you go. This is what the Meta Honey dressings look like. It smells like honey, looks like honey. I do only use this at night though, because it leaks, it melts, and it gets everywhere. But it's really great at using the body's own enzymes to kind of like slough away that dead tissue and get rid of it and like help move the wound process along. And that's why people find it so successful. There are a lot of really great articles online if you're interested in looking at Meta Honey or Manuka Honey. So please look that up. It does come in a tube, like a gel tube, where you can just squeeze out the actual honey and use it in a wound. But I figured, you know, I need something that's going to absorb a little bit as well. Let me get it in a dressing form. And then again, same thing overnight. I'll put gauze. I usually put a thicker layer of gauze overnight because the dang thing leaks. I mean, I've had it leak through pants during the day, which is super fun. So I'm going to continue this. It has shown progress even since last Wednesday when it was silver nitrated by my surgeon. So I'm excited. The drainage has cut down quite a bit. So that is, I mean, it could be good, could be bad, I don't know. I think a question though that people have about this is it painful? And to be perfectly honest with you, not really. I mean, almost all the pain is gone. I would say that the pain that I had before surgery with my anus and rectum being so damaged, that was way worse than the pain that I feel now. And I have been getting that question quite a bit because there are many reasons that people get ostomies. It could be colorectal cancer, it could be motility disorders. There's a whole slew of reasons why people get ostomies. In my particular case, because I have Crohn's disease, and that is, a disorder that affects the whole GI system, my colon, rectum, and anus were attacked the worst, which is like, I'm fortunate because that means my small intestine has been in fairly good condition, knock on some wood for me. But because there was so much scar tissue and damage, like irreversible damage in the rectum and the anus, sorry, my dogs are barking, it was better to take it out. It was just not good. But some people don't need to do that. Some people live with a disconnected colon, rectum, anus forever, and they have an ostomy. One thing you have to look out for in that situation is diversion colitis, because when you're eating food, you're getting the fatty acids that your colon needs to survive, and then when you have the ostomy diverting away, your colon can get irritated. But I don't have a problem because I don't have a colon anymore. That is how I am caring for the wound right now. Zach is calling me because we are going to, I think, take the dogs on a WALK. So we are going to go do that. You guys enjoying your walk?
I think so.
How about you after running?
I'm tired.
Oh. At least it's
beautiful.
The dog of the dogs. Dixie, Holly, and Bruno, and Nanners is home. Because she's stumpy.
And she doesn't do well on warmer days.
No, she really doesn't.
Or
She's
even
got
cool
that.
days.
No, she's got the short snout, so she winds up barely being able to breathe by the end of it. So sometimes we'll take her on a modified short walk, and then we take the others for a longer one, but do what you can. Okay, we just got home. There's the barn. It's beautiful. We're gonna check out inside, although I don't think there's too much. I don't think there's too much that's changed in here, so let's see. Yeah, go ahead. Go ahead. Ooh. Oi, some mess in here. Alright, you wanna walk around? Oh, is this the wood? So this is the wood that they planed today. This is for the tables, but we need 8-foot planks.
Yeah.
Oh, did they plane? No, they didn't plane this. Yeah, no, that's the old
I
wood.
think these are the plain ones. But remember, we were going to try doing the, was it biscuiting?
Oh, yeah, to like stagger pieces so we can use shorter pieces but
Yep.
still get an 8-foot table. Yeah. All right, we're gonna end this vlog here as our dogs run out of the barn. And
we're waiting.
so.
All
right, guys.
Supper
Thanks.
time.
Yep. Thanks for watching this video. I'm gonna make tuna steaks to get my protein in to help my wound.
Let's do it.
Let's do it. See you guys.